Good evening all. Today our concept is about shoulder joint. Shoulder joint is important for 15 marks question. Okay, it is very important for 15 marks as well as it is very important for in the viva section. Okay, it is very important for 15 marks and very important for viva section. Okay, now while studying about the shoulder joint, first we should know what type of joint it is. Okay, now the shoulder joint belongs to synovial joint. Okay, it is synovial joint of ball and socket variety. Synovial joint of ball and socket variety. Synovial joint of ball and socket variety. Next. Okay, next we goes to the articular surface. Articular surface. We have two articular surfaces. Here one articular surface is from the humerus and one articular surface is from the scapula. Okay, now the head of the humerus attaches to the glenoid cavity of scapula to form shoulder joint. Okay, shoulder joint. It is also called as glenohumeral articulations. The head of the humerus articulates with the glenoid cavity of scapula. It is also called as glenohumeral articulation. It is the weakest joint in the entire body. Shoulder joint is the weakest joint in the entire body. Weakest joint in the entire body because see, you can observe here clearly the complete head of the humerus is not articulating with the scapula. Only 1/4 part. Only 1/4 part. Remember this one. Only 1/4 part of humerus, head of humerus articulates with the glenoid cavity of scapula. So it is the weakest joint of entire body. It dislocates very easily, and because of this type of articulation, it is very movable, easily movable joint in the entire body. It is very easily movable joint in the entire body. Now the stability of the joint is maintained by coracoacromial arch, and here we can see the coracoacromial arch. Next, the musculocutaneous cuff. Okay, the musculocutaneous cuff is formed by the rotatory cuff muscles. Okay, next, glenoid labrum. Here you can see this is glenoid cavity and here this dotted line is labrum. Okay, the stability of the joint is maintained by three parts: coracoacromial arch. See, coracoacromial arch, first one. Second one is musculocutaneous cuff, and the third one is glenoid labrum. Glenoidal labrum. These three give stability to this joint. Next, while goes to the ligaments, the first ligament is capsular ligament. While studying about the ligaments, see, ligaments are very important. Ligaments are very important in this concept. The first ligament is capsular ligament. CL, capsular ligament. This capsular ligament is very loose and it permits free movement. Okay, the capsular ligament medially, here we can see the capsular ligament here. The capsular ligament medial attaches to the scapula and lateral attaches to the neck of the humerus. Okay, the capsular ligament attaches from the neck of the anatomical neck of the humerus to the glenoid cavity of the scapula, like this. Okay, glenoid cavity of scapula like this. Okay, this is next. It is lateral attaches to the neck of the humerus and medial attaches to the scapula. Next, it is anteriorly. The capsule is reinforced by supplementary bands called superior. Here we can see the supplementary bands. Three types of supplementary bands here to the scapula: superior, middle, and inferior. Okay. These three bands reinforces the anterior part of this ligament. Okay, reinforced means additional strength. Okay, reinforced means additional strength. Okay, next, in these three parts between the superior and middle glenohumeral ligaments, it is the weakest point. It is the weakest point for dislocation. Okay, between the superior and middle glenohumeral ligament, there is a weakest point for the dislocation, and the weakest point is called foramen of weight bridge. I will write here foramen of weight bridge, foramen of weight bridge. Okay, the next ligament is coracohumeral ligament. Coracohumeral ligament, this is the second ligament, coracohumeral ligament. It extends from the, see in the name itself it is given that coracohumeral, coracoid process. This is coracoid process, this is coracoid process, this is humerus. So this ligament attaches from the coracoid process to the humerus. So the name itself is there, coracohumeral ligament. It extends from the root of coracoid process to the neck of humerus. Okay, it gives strength to capsules. It gives strength to capsules. Now the third ligament is transverse humeral ligament. Transverse humeral ligament. In the transverse humerus ligament, we can observe that the transverse humeral ligament is placed from the between the greater tubercle and lesser tubercle. It bridges the upper part of greater tubercle and lesser tubercle like this. See, it bridges like this. Okay, it gives strength to the humerus, and in the groove it passes some arteries and some tendons of some muscles. Okay, it gives support. Next, the next ligament is glenoid labrum. Okay, glenoidal labrum, and we can observe here this is glenoid cavity, and here the dotted lines is glenoidal labrum. Here the dotted lines are glenoidal labrum. These labrum, we call it labrum, we also call it as lips. Okay, these labrum is fibrocartilaginous rim. Okay, it covers the entire margins of glenoid cavity. And it increases the depth of the cavity. Okay, if the cavity is of if the cavity is this much of depth, it forms additional depth. That means it labrum continues like this. So it gives additional depth. Okay, this is all about ligaments. There are 4 ligaments. I repeat again, there are 4 ligaments: capsular ligament, coracohumeral ligament, transverse humeral ligament, and glenoidal ligament. Next, our next concept is relations. While studying about relations, there are 4 types of relations: from the superior surface, inferior surface, anterior surface, and posterior surface. From the superior surface, and here is the superior surface, we can see the coracoacromial arch. This is coracoid process, this is acromial process. So we can see the coracoacromial process from the superior surface, and the supraspinatus muscle and deltoid muscle. From the inferior surface, we can see the long head of triceps brachii. From here to here, long head of triceps brachii and axillary nerve. It passes from scapula to the scapular region to the humerus like this. And posterior circumflex humeral artery. It passes from the like this. Posterior circumflex humeral artery. Okay, this is inferior surface. And in the anterior surface, we can see subscapularis. Subscapularis means here. Entered this part is subscapularis. Okay, subscapularis, coracobrachialis, short head of biceps brachii and deltoid muscle. From the posterior surface, we can see infraspinatus, teres minor, and deltoid muscle. Okay, from the superior surface, we can see coracoacromial arch, subacromial bursa, supraspinatus, and deltoid. From the inferior surface, we can see long head of triceps brachii, axillary nerves, and posterior circumflex humeral artery. From the anterior surface, we can see subscapularis, coracobrachialis, short head of biceps brachii, and deltoid. From the posterior surface, we can see infraspinatus, teres minor, and deltoid. Okay, now one of the important concepts is blood supply. Blood supply it will give for the 2 marks question and in the Viva section, as well as 2 or 3 marks in the essay question. It includes 2 to 3 marks in the essay question. The mnemonic of the blood supply is PASS. Pass. Okay, the first one is posterior circumflex humeral artery, anterior circumflex humeral artery, suprascapular vessels, subscapular vessels. Okay, posterior circumflex humeral vessels, anterior circumflex humeral vessels, suprascapular vessels and subscapular vessels. Okay, these are blood supplies. And while goes to the nerve supply, nerve supply is also very important, same as like blood supply. Nerve supply, the mnemonic of nerve supply is mass, M-A-S, mass. That means musculocutaneous nerve and axillary nerve and suprascapular nerve. Musculocutaneous nerve, axillary nerve and suprascapular nerve. These are all about nerve supply, ligaments, and we have completed the articulations, ligaments, blood supply and nerve supply. Next we will go to the movements of shoulder joint. Movements of shoulder joint, I will provide all the pics of movements of shoulder joint in the notes in the available in Instagram. And the movements are flexion, extension, adduction, abduction, medial rotation, lateral rotation and circumduction. Flexion, the clavicular head of pectoralis major and anterior fibers of deltoid muscle helps in the flexion, and deltoid and latissimus dorsi helps in the extension. Okay, pectoralis major, pectoralis major, latissimus dorsi, short head of biceps brachii, long head of triceps brachii helps in the adduction. Supraspinatus, deltoid muscles, serratus anterior, upper and lower fibers of trapezius helps in the adduction. In the medial rotation, pectoralis major, anterior fibers of deltoid, latissimus dorsi and teres major helps in the medial rotation. Posterior fibers of deltoid, infraspinatus and teres minor helps in the lateral rotation. And one more point is circumduction. Circumduction means complete rotation of hand in 360 degrees. For example, if we see the cricket is one of the favorite game of all the Indians, and if in the cricket game the action of bowling includes in the circumduction. See, rotation of the head in 360 degrees, it is called circumduction. In the circumduction, all the muscles included in flexion, extension, adduction, abduction, medial rotation and lateral rotation included in the circumduction. Okay, next our one of the important concept is clinical anatomy. Clinical anatomy. Okay, important concept. In the clinical anatomy, we can observe 4 types of clinical anatomies. The first one is dislocation. See, the dislocation occur because the head of the humerus is only 1/4 articulates with the glenoid cavity. So the dislocation occurs very easily, and most common dislocation of the joint in the entire body. Okay, with the dislocation, if the dislocation occurs, many nerves and many arteries damages because of the dislocation. Next, ankylosis, spelling ANKYLOSIS. Okay, ankylosis means joint pains. Next clinical anatomy is referred pain. Referred pain means the pain occurs irrespective to the place. Okay, the pain occurs irrespective to the place or region. Okay, for example, if the heart pain occurs, the pain we can sense it on the shoulder joint. Okay, the pain we can sense on the shoulder joint. The place of the heart is different from the shoulder joint, but the pain of a heart occurs in the shoulder joint. Next, frozen shoulder. Next important clinical anatomy is frozen shoulder. Frozen shoulder means restricted movement. Okay, all the movements are restricted for only for certain angles, only for little angles. This occurs for at the age of 40 to 60 years. It is common at the age of 40 to 60 years, and the frozen shoulder may takes place 2 years. It occur. If the frozen shoulder occurs, it suffers for 2 years to cure completely. It takes 2 years to cure completely. This is all about clinical anatomy. We have completed in the shoulder joint. We have completed the type of joint and articular surface and ligaments. There are 4 ligaments: capsular ligament, coracoacromial ligament, glenoidal ligament, transverse humeral ligament. And while regarding to the relation superior, inferior, anterior and posterior relations, regarding to the blood supply, posterior circumflex humeral vessels, anterior circumflex humeral vessel, suprascapular vessels, subscapular vessels. Regarding the nerve supply, musculocutaneous nerve, axillary nerve, suprascapular nerve. And regarding to the movements of shoulder, flexion, extension, adduction, abduction, medial rotation, lateral rotation and circumduction. Regarding the clinical anatomy, dislocation, ankylosis, referred pain and frozen shoulder. And in the clinical anatomy, we can also include that the dislocation at the superior and middle region of glenohumeral ligament, foramen of weight bridge. Okay, we can also include foramen of weight bridge. This is all about shoulder joint. Shoulder joint is very important for 15 marks as well as 5 marks. Okay, it is frequently asked questions for every 2 years. Okay, thank you all.